I'm going to talk now about the many challenges that we must face in order to make causal relationships and ultimately prevent new cases. Well, first of all, injuries may long precede the scientific understanding of the causes of injury. Various toxins can have very long latency periods. Most substances have entered and still enter the marketplace without proper toxicity testing. Industries may not disclose significant information about toxicity of their products. Systematic toxic vigilance programs provide an effective communication of clinical findings on exposed individuals are often inexistent or underdeveloped, oppositely to what happens with pharmaceutical entities. Case reports and case series, especially without toxicological analysis, are unfortunately very difficult to get published, read, and properly diagnosed. Contemporary medical education still largely ignores occupational and environmental health issues. Physicians become really worried about the possible scrutiny that judges, attorneys, and other people may exert in medical files of these patients. Physicians also become very fearful of being sued by defendants and, of course, of the hostility of the communities that economically depend on them and that are their main clients. Interinstitutional and interdisciplinary research on neurotoxicology is very insufficient. Epidemiological studies often have to heavily count on probabilistic techniques to deal with variability and uncertainty of exposure assessments. Inadequate duration of follow-up and cases lost due to missed follow-up may compromise causal inferences of epidemiological studies. Poor exposure characterization and inadequate control groups may lead to an increased number of false negatives. Biomarkers can be incorrectly used and interpreted. Experimental toxicology studies focus on exposures to single substances one at a time, with limited number of those levels, limited exposure duration, few standard effect measures, and inbred strain to limit the effects of genetic variability. Studies showing any signs of toxicity, unfortunately, are more frequently accused of methodological flaws and consequently of being junk science or pseudoscience. In order to protect ourselves, we scientists are particularly careful about mentioning relevant findings, culminating in an excessive linguistic use of double negatives and words like maybe and perhaps. I recently went to Costa Rica and one of the lecturers almost asked, sorry for finding that DBT lowers the IQ of children. Oh, I know that DBT is a very important molecule. Recommended procedures for risk communication. This encourages disclosure of possible risks in order to avoid false alarms and mass hysteria. Consequently, lay people may think that we are more uncertain than we really are about the neurotoxicity of chemicals. By the way, psychiatric diagnosis that may be caused or worsened by neurotoxications commonly become the main and only diagnosis, especially conversion disorder, even when the patient has no signs of multiple chemical sensitivity. People suffering the effects of neurotoxic exposure have also to deal with the burden of proof. Professor Paul Trainer from the University of California at Riverside has eloquently stated that. He states that after implementation of Daubert, courts made it more difficult for scientists to testify and has increased the ordinary burdens and standards of proof to the plaintiffs. Attorneys have become more selective when screening toxic tort cases. unfortunately, plaintiffs have to face significantly increased pretrial losses. The banalization of litigations and the common public image of plaintiffs and attorneys as greedy, insensitive, and unfruitful are shaping the currently widespread blame the victim ideology. Toxicologists are also faced by regulatory challenges regarding the existence of less toxic alternatives to the chemicals in the process of being banned. And then we have to remember Rachel Carson. Because of that, one of our pioneers is until nowadays unfairly criticized. And we have to remember that once she has written that marvelous book, that it is ironic to think that man might determine his own future by something so seemingly trivial as the choice of an insect spray. All this has been risked for what? How could intelligent beings seek to control a few unwanted species by a method that contaminated the entire environment and brought the threat of disease and death even to their own kind? So I ask you, is it inevitable to use insecticides? How did man control vectors 100 years ago? Then I have to bring you the image of Oswaldo Cruz, a very interesting Brazilian physician. He basically tried and managed to control vectors by educational campaigns, reorganization, elimination of stagnant water faucet, proper disposition of waste, obligatory notification of cases, and special education of young scientists and public health workers. And until nowadays, the mainstay of vector control in Brazil is non-chemical measures. But then, synthetic chemicals became an integral part of our lives, as well as chaotic urbanization. And the use of chemicals was eventually considered inevitable.